Hello and welcome to MediByte. We're going to get into something today that's, well, it's super important for your health, but it can sometimes feel a little overwhelming. We're talking about your obstetric and gynecologic history. So let's just dive right in and figure out what this really means for you.
I want you to think about your health history a little differently. It's not just a boring list of dates and procedures, right? It's actually a story. It's your story, and you and your clinician are basically co-authors, exploring all the unique chapters of your body's journey together. But here's the thing. How do you know which parts of the story are important to tell? It can be tricky. So in this explainer, we're going to clear all of that up. The goal is for you to walk into your next appointment feeling totally confident, prepared, and really in the driver's seat of that conversation. Okay, so let's get into the why. We're calling this your health's blueprint, and that's a pretty big deal. So why does it matter so much? Let's break down why this information is absolutely critical for your care. You know the feeling. When you're at the doctor's office and they start asking all these really personal questions. It can feel a bit much, I get it, but honestly, it's not about being nosy. Think of each question as a puzzle piece. Your doctor is trying to put together the most detailed picture possible of your health so they can create a plan that's tailor-made for you, not just some one-size-fits-all approach. And believe it or not, this conversation, it's one of the most powerful tools a clinician has. Seriously, it's not about the fancy equipment sometimes, it's about the information you provide. It lets them see your unique needs, spot potential risks way ahead of time, and build a healthcare plan that is genuinely right for you.
All right, so a huge chapter in this health story is your menstrual cycle. I like to think of it as a kind of monthly report card on your hormonal health. And trust me, it's packed with vital clues that we really need to pay attention to. So let's see how these simple questions come together to build a really complete picture. Things like, how old were you when you got your first period? What's the pattern like? Is it regular or all over the place? And what about the flow and any symptoms like pain or weird bleeding between cycles? See, this isn't just period talk. It's about spotting patterns that could signal things like hormonal imbalances, fibroids, or even something like PCOS. Okay, building on that foundation, let's move to the next major chapter in your health story, your obstetric history. And this is exactly what it sounds like, a detailed record of any pregnancies you've experienced.
And when we say detailed, we mean it. Every little piece of information matters here. How many pregnancies, when they happened, how they ended, and especially if there were any complications. And here's a great example of why this is so important. Let's say you had high blood pressure during a pregnancy. That's not just about managing the next pregnancy. It's a massive clue that your long-term risk for heart disease could actually be double. That's a game changer, right?
All right, now we're going to touch on a part of the conversation that, let's be honest, can feel pretty sensitive for a lot of us. But it is absolutely essential for getting a complete picture of your well-being. And I really want to emphasize this. This conversation is a completely safe and confidential space. Your clinician is your partner in this. They're on your team. And being open here is what unlocks the preventative care and the right treatments that you might need. So we're talking about things like sexual activity, what you use for birth control, any symptoms like pain or unusual discharge, but it also includes things you might not think about, like breast health, menopausal symptoms, even incontinence. Opening up about these topics is what allows for a truly complete picture, and it helps with everything from routine STI screenings to catching conditions that could easily fly under the radar. Okay, so we've gathered all these clues, all these pieces of your story. How does a doctor actually put it all together? Let's walk through a couple of common examples to see how this works in the real world. Here we go. This is your history in action. Let's say you go to the doctor with pelvic pain. Well, the clues you provide, things like, does it happen during your period? Or does it hurt during intercourse? Along with your surgical history, that all helps your doctor play detective. It helps them narrow down the suspects, right? Is it endometriosis, an infection, or something else entirely? Your story points them in the right direction. And it's the exact same idea for something like abnormal bleeding. The specifics you share, the pattern, the timing, how heavy it is, all combined with things like your age or what medications you're on, that helps pinpoint the cause. It could be uterine fibroids, a hormonal thing, or maybe something that needs a closer look, especially if it's happening after menopause. And this leads to such a crucial point. Your obs-gyn health doesn't just exist in its own little world. It's not in a bubble. It's all connected to your general health, your surgical history, your lifestyle, your family's health history, and yes, even to deeply personal experiences you may have had. It's all part of the same big interconnected puzzle. So, what's the big takeaway here? It's this. Your story, your history, is literally the most powerful tool you have in your own healthcare. Seriously, when you understand all these different parts and you feel confident sharing them, you stop being just a passive patient. You become an active, empowered partner in managing your own health. So I want you to just take a second and think about that. After everything we've talked about today, is there one little detail, one symptom, one concern you've maybe held back before? Because empowering your next doctor's visit could start with just sharing that one thing. It's a small step, but it can make a huge difference. Hey, if you found this explainer helpful, it would mean a lot if you'd give it a like, and maybe share it with someone you know who could use this information. And of course, don't forget to subscribe to MediByte so you don't miss out on more clear, trusted health info. Thanks so much for watching.